Oh, darn. Extreme dragon damage. Talking about getting handsy, and that's definitely not compatible with life. Today, we're breaking down and reacting to all the fiery medical scenes and medieval fantasy injuries from House of the Dragon. Let's dive right in. Ooh. Even just getting that much heat on you, even if it's not like burning your skin or burning your clothes, it's going to be hard to breathe. You might actually singe your hair, your eyebrows, your eyelashes. If the nose hairs have been singed, that means that the fire potentially went into the airway, which then increases the risk that you're going to have swollen tissue, which could then block your airway. Oh. The metal got so hot that the skin actually melted onto the metal. Same thing happens at the hospital with different materials. We're trying to get them off of your skin that have been melted onto it or vice versa. Really hard to do, increase the risk of bleeding, pain. We could give you IV pain medication, oral pain medication. We can do nerve blocks to certain areas of your body. If these wounds go exposed for a long period of time, you can go into septic shock, sepsis, bacteremia, you can get bad infection and die. But the other component is you're going to have third spacing, swelling, loss of fluids, and if you don't replenish those fluids appropriately, then you can actually go into organ failure and potentially die that way. These wounds are pretty bad. Pretty. Unfortunately, with these wounds, you have open skin, missing tissue to the area. You need a skin graft. Your skin is not going to just heal. There's no skin to heal anymore. This is definitely not how you would clean these type of wounds. This is very gentle, slow, and I don't know what they're actually really doing. The concern is a significant increased risk of infection, as well as loss of body fluids. Back then, they didn't have a significant means to be able to protect you against those things. Laceration with a big sword, okay? Gets lacerated to his left thigh. Most of the time, it's just gonna be soft tissue injury, but if you get high up into the groin area, that's literally where your femoral vein and your femoral artery are, as well as the nerve that's coming down. They all are in one big bundle together. You know, it's interesting, they're taking all these hits, the face, the body, the knee, but they're wearing all this like metal, and so you're getting hit with hard pieces of metal. You'd actually expect the damage actually to be much greater than just getting hit with your own flesh and bone. We were born together. You party not! Two different mechanisms of strangulation: compression of the major blood vessels on the sides of your neck, decreasing blood flow to the brain and out of the brain, increased risk of stroke, passing out, but not actually dying. If you continue to press the airway, you push really hard onto the trachea, and then you pass out again due to hypoxia. Oh, that's a big sword. Stab wound to the abdomen going through the back. Still standing, which is fine, actually appropriate, but stab wounds or puncture wounds tamponade the areas, so they block the hole that you've made until you release it, and then the hole opens up. So you still have a few minutes of life before you'd bleed out from a hole in your aorta in the abdomen. Taking metal to the face, you can have what's called a Lafort fracture. You can just have a sinus fracture or an infraorbital wall fracture. You can have a zygomatic arch fracture, a nasal fracture, unlikely mandibular fracture, but you can actually fracture both sides if it compresses pretty hard, and then you can lose some teeth along the way. No! Oh, darn! Whoa, bring that to the hospital with you. Is there potential for you to reattach it? Maybe, actually, because it's such a clean wound. If that sword is sharp enough, there's a potential that you can find all the appropriate vessels and nerves and try to reattach them. But the issue is going to be the nerves. Even if you reattach the nerves, you're probably going to have a significant amount of nerve dysfunction. Ooh, blunt object to the side of the face. It looks like it hits him in the jaw on the left side, which increases the risk of having a fracture. So we see a lot of injuries like this fracture of the mandible on this side, but a lot of times you actually get another fracture on this side. It just has to do with how the energy is going out. Pretty disfigured face on the right side. You have evidence of skin damage, potentially burn. The nose is actually shifted to the right. That can happen in somebody who's had a previous fracture or congenital malformation while you were born. I'm assuming a dragon's fire and breath is equivalent to that of like a crematorium. Burning flesh really smells horrible. Their airways are melting. They are not getting oxygen. They will pass out pretty soon, and then they will be hypoxic and unfortunately pass away. Awful. Usually the burns that we see are related to hot fluids, not necessarily fire. The burns that I've seen due to fires are usually come in like delayed, like a couple days later when they notice that the wounds are not healing. We see a lot of burns related to the sun. Saw a lot of first and second degree burns. Haven't seen a third degree sunburn, thank goodness. That dragon is pretty pissed off. Just chewing on people. Crush injury and impaled. We worry about crush injuries because of the secondary effects. So you have the injury to the tissue, but then you have the issue of swollen tissue that's now broken down, almost like rhabdomyolysis. You have a breakdown of muscle tissues and cells, increases the damage it can be to the kidneys trying to filter out all this debris. And then you have an increased risk of having hyperkalemia, which is a lot of potassium in your system, which increases the risk of cardiac arrhythmias and death. Awful. Significant amount of abuse here. Unfortunately, we do see this in the emergency department. We have a keen eye to be able to see if wounds are at different stages of healing, stories that don't make sense. If we have a suspicion that there might be some sort of abuse, we have a very low threshold to notify like Child Protective Services. Here you can see similar to what you would do at like a funeral home where they prep a body and they would put it back into appropriate positions. Interestingly enough, they have the exposure of the sutures versus having something around the neck to protect that area. Pretty gnarly though. He obviously has a mask on the right side of his face. I don't know what's underneath there. The only time we ever see somebody with a face mask or something, usually it's covering the eye itself, not typically covering the whole face.
Will have your tongue for that.
Oh, not his tongue. Whoa.
I did not see that coming.
Cut just above the posterior pharynx and the floor of the mouth. You'd have a ton more bleeding at this point, and you have the posterior aspect of like the spinal cord in the back, just depending on the angle where it was cut. Whoa. We get a lot of people that come in with tongue trauma and they bleed a lot. There's a lot of blood vessels there. If we get the bleeding under control and there's not a big defect, actually won't be closed because it'll heal on its own. It's very regenerative, so to speak. Well, okay then. We definitely see people who have burn injuries. Some are minor and some are massive. You have first degree, second degree, third degree, and even fourth degree burns, which are rare. Your first degree burn is that sunburn. A lot of times second degree burns we see often with like scalding hot water, oil, and explosions typically cause third degree burns. Obviously this is not 100% thing or a complete list, but those are like in general.
It would suit you.
Ooh, nice. Fist fight. Obviously, we should not be fighting.
Them's fighting words.
There's gonna be some bruising, bleeding, maybe some lacerations, but most of the blood probably comes from the nose or the mouth. When you hit somebody's mouth, the teeth can then cut your mucosal membranes, causing it to bleed. Oh.
You will die
screaming in flames just as your father did.
We have a rock that he's threatening to smash or throw at somebody, which is going to be a significantly hard object, which could actually kill an individual if it hits your skull in the right way. You can cause a epidural hematoma, a subdural hematoma, or even a subarachnoid hemorrhage. Just depends on the mechanism. Throwing dirt in the eye. I don't know if any of you have had any foreign bodies in the eye. It is very uncomfortable. It potentially is going to scratch your cornea. The clear covering over the colored part of your eye, which is highly innervated, means that there's lots of nerves. So if there's any abnormality to it, it's going to hurt a ton. Oh, yes. Causes a laceration to the face through the eye. The eyelids are very thin skin and highly specialized because you also have what's called the tarsal plate where your hairs are growing out of, and you need to have that perfect because you'll have chronic issues relating to blinking of your eye. Looks like maybe they just chopped off a hand with an axe and made a pretty gruesome noise. We do see people get amputations of their fingers and hands. Please bring it in with you. You never know if somebody can reattach it, aka a replantation specialist. Whoa! Removal of this gentleman's manhood. Horrible pain, obviously uncomfortable. You have major blood vessels down there. They can bleed out, so the bleeding needs to stop. Similar to like the guillotine when somebody loses their head, you're going to still have some muscle movements. You're going to bleed out, but it will take a few seconds at least for the body to stop pumping blood, as well as the body to go limp and not have any muscle tone or action potentials.
It was an unprecedented roundup of criminals of every ilk. Your brother made a public show of it, meting out the summary judgments himself.
Watching the intense injuries can be a little stressful. Even sometimes when I come home from the hospital, I need a little more chill in my life. And that's when I use Chillax by my company, Life Happens. Check out Chillax at lifehappens.com or on Amazon.
They're going to bring the babe out now.
Normally when you're about to deliver, the baby's inside the womb, right inside the uterus and in different positions. But when the baby's ready to deliver, it's the head down position, meaning that the head comes first. And we all have heard about this, know this, you know, it's crowning. So you see the head coming out first. And that's the appropriate way for the body to come out.
No, it's all right.
What does that mean? I'm serious.
It's all right, they're going to bring the babe out. It's all right.
You can have a leg, an arm, a butt. You can have different positions, and then makes it much harder for the baby to be delivered and increases the risk of injury to mom and baby because it might fail to progress.
I'm making the first incision. Please hold it still.
You heard them say they're making the first incision. Typically, a C-section will be a low, basically horizontal cut down in the pelvis area. So you're cutting through the skin. Then what ends up happening is you're actually trying to get to the uterus, which is a muscle too, and you have to cut through that to get the baby out. So that's typically why they say first incision, and maybe they're going to go into the second incision.
Don't be scared.
The problem back then is they had no way to really control the bleeding, and it's a very bloody process versus nowadays it's very controlled. As you do your cuts, you're actually, cauterizing and stopping any bleeding and preventing the woman from bleeding out, and then you can deliver the baby. And you can sew up the uterus, and then you can sew up the skin thereafter. Wow. I mean, obviously it's not sterile. We also use anesthesia, so you don't feel the pain. Typically, in this circumstance, in modern day medicine, you're gonna use an epidural, and then they'll also anesthetize the skin in that area, so that way it's not as painful. Wow, so he sacrificed his wife to get the baby born. So I believe that there was a non-progression of the delivery, the baby wasn't coming out. And so what could happen is if the baby stays in for a long time after the membranes have ruptured or the fluids come out, you increase the risk of infections, so sepsis, and you could die, and the baby can die. House of the Dragon, I thoroughly enjoyed it. I've even watched all of the Game of Thrones, obviously. Season 2 is shaping up to be pretty interesting and fun to watch. So if you guys enjoyed this, definitely check out this playlist right here, binge watch everything. And as always, do me a favor, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.